Sydney, as well as Professor Richard Osborne from Swinburne University of Technology, along with hundreds of other speakers. The International Health Literacy Association is a non-governmental, not-for-profit, member-based organization with members from academic and professional disciplines. And our aim is to improve health literacy for people and societies through capacity building and policy research and practice. The Global Health Literacy Summit would not be able to take place without gracious support from our sponsors and partners. And here I want to highlight the Ministry of Science and Technology, Bureau of Foreign Trade and Health Promotion Administration in Taiwan, as well as the IDA Healthcare Group, IHLA University, and Merck Sharp and Dome, Academy of Dentistry International, our Asian Health Literacy Association, Taiwan Association for Health Literacy and Communication, and many more. So thank you to our colleagues and sponsors and partners for hosting this event. Let me hand over the words to my colleague Diane Levin-Samir, who is member of the board of International Health Literacy Association, and she has been chairing the program. Diane.
Hello, everybody. I'm coming to you from Tel Aviv. I had the privilege of chairing the program committee for this conference. I'm from the University of Haifa School of Public Health and Clalic Health Services, director of the Department of Health Education and Promotion. And the program for the summit has been in development for over a year and a half. We are very pleased to be able to offer to the attendees a very rich program, including the experts that Dr. Sorenson mentioned, who have volunteered their time to be a part of this summit and to contribute. We have over 410 participants, and we have hundreds of presentations. The presentations will be oral sessions, they will be symposia, there'll be workshops. We have meet the authors, and we have very special mentoring masterclass sessions. All these sessions are there to provide a very rich menu of learning experiences, exchange, debate, discourse, discussion about health literacy and about the relevant issues of health literacy now, particularly coming in and out of the pandemic, but also looking at the big picture, what it means for climate control, what it means for national policies on health, global policies. So our plenary sessions will be touching on those very high level, very, very relevant and actual issues for the world. We're going to be looking at digital health literacy, what's going on with digital health, what does that mean for health literacy? What does it mean for access to information, to health resources? We will be looking at COVID-19. What challenges has that brought us that we weren't aware of before? And where has that given us opportunities for taking health forward? We're looking at equity. We're going to be looking at the way in which we can close disparities in health through health literacy, but also how we can realize and discover some of the discrepancies and some of the gaps that we didn't know were there. Health literacy is helping us do that. So we'll be discussing that as well at one of the high-level plenary sessions. There's Sir Michael Marmont from the UK. We'll be speaking about that topic as well. We're going to look at also national and global policies for health literacy. We know that if we need to move our health forward, public health, healthcare forward, we need to have policies that will allow to be able to offer resources and sustainability for health literacy. So those topics will be deliberated and will be presented as well. So with all of these overarching topics together, we're going to be coming out, we hope, from the summit with a lot of conclusions, a lot of recommendations, a lot of issues that we all will be taking forward from the summit on. So we see this as a wonderful opportunity for people from all over the world. The program will be running through many time zones. We are going to be reaching all continents of the world except for Antarctica, but we will be welcoming the attendees at time zones that we know are for them relevant And we have been very sensitive to that in the program by trying to offer the times for the programs at a time that people can, from their countries, from their area in the world, access. So we're thrilled that so many people are going to be coming together for the conference, for the summit, and it's going to be virtual. So we know that it's going to be a challenge for people who are used to meeting together, but COVID has taught us how we can stay together and support each other virtually as well. And just a last point, the program committee, who are experts from all over the world, who've worked so hard together over the past year and a half to bring this rich program together. They also come from different parts of the world, and this is an opportunity to thank them for all the time that they volunteered to bring this rich program to fruition. So with that, I'm very thrilled to introduce Professor Peter Chang, the Vice President of IHLA, who will also be updating you about the summit and introducing some of our other speakers.
Thank you so much, Diane. And thank you, Christine, from Copenhagen, and also Diane from Israel, Tel Aviv, if I'm correct. It's I think I should give this privilege to Sabrina Kursrashi. She is in Boston in the early morning. She actually wake up to this occasion. So maybe I giving the microphone to Sabrina. Thank you for joining us this early morning in Boston.
Oh, thank you, Peter. I'm very pleased to be here. Thank you, Christine Sorenson, Dr. Sorenson from Denmark, the president of the International Health Literacy Association, for opening this press conference. This is a global event. We have people from, as Dr. Levine Zamir had mentioned, from Israel, people from 6 continents, coming to as members of the International Health Literacy Association, but also coming to this milestone global health literacy summit event. So we'll have participants from South America, North America, Europe, Asia, Africa, and Australia. As Dr. Levine Zamir had said, over 400 participants. The International Health Literacy Association is dedicated to the professional development of people all over the world working to improve health literacy for their community, for their country, for their region and continent, and for the world. Health literacy is the ability to find, understand, evaluate, communicate, and use health information to make informed decisions. It is dependent on the skills of individuals, and that's what we try to do, is to raise the skills of individuals in our community to understand, use, evaluate health information. With COVID-19, it's very important with a new pandemic to be able to evaluate information and be able to use it. It's also dependent on the skills of health professionals and how complex health information is. And so we work with hospitals and health centers and healthcare professionals on how to communicate in ways people can understand. This is a milestone event for the International Health Literacy Association. We have 1,600 members from around the world. This session, this 3-day event is going to include presentations, oral presentations from over 160 participants. We have workshops. We have special interest groups that are the backbone of this professional association, the International Health Literacy Association, that is really driving the content of our research, and they are hearing from their community in terms of what needs to happen to make a difference in the world. So we'll hear from researchers as well as best practice and practitioners giving presentations on what works and what they've tried. In multiple languages. We also need to think about what we call plain language equity. There's an interest group on health literacy and health equity. We have an interest groups on health literacy and cancer, interest groups on that look at the social costs So that is another really unique aspect of these 3 days that we're going to spend together. I must say, if you're not yet registered to participate, today is the last day to register. So please do go to our website, I-HLA.org, I for International Health Literacy Association.org. Again, I-HLA.org, and you'll get linked to the website and you can register. And we look forward to seeing you over the next 3 days. Peter, back to you in Taiwan. Is that right? Professor Peter Chang, our Vice President.
Thank you so much. Thank you so much. Actually, this is such a unique occasion that we have 6 continents all connected. And this press conference actually is warming up before we start from Sunday. I am very privileged to join all of you. And I see there was a very important historic milestone at this time of the year, 2021. We already almost 2 years into this COVID-19 pandemic. And luckily, IHLA was established in 2016. Can you imagine if there was not such an important global health literacy organization? We will be much worse in our coping with the COVID. So luckily we were here, but before the COVID, we see the internationally, there was a big disparity in terms of health literacy. Even in Europe, even in North America, there was a big disparity. It means that the society, the global community was not ready to handle we're learning health literacy, but we are not so much well developed yet. That we see area was much behind in health literacy, even in Asia. That's the reason we see that's very important work to have a health literacy education and research throughout the region. And now we have a COVID, and that's giving us very tremendous lessons. Really, we have to work health literacy much more than before. And this is the time that we are in 2 years in this COVID, and we need to get out of it. But health literacy is very important for us to get out of it, because most of the people in the general public, they have to learn what is the virus, why the virus is different from the others, what is the measure they can take to be against the virus. Now we are facing vaccination. There was a lot of tremendous confusion and reluctance regarding vaccination, and which is so important for us to get out of it. So this all related to health literacy. And I see when we raise the issue of health literacy right before the COVID came, and we are right in the middle of this turmoil. And I hope IHLA will lead all the continent and all the people in different countries, the health profession, the public policy makers. We need to work more in health literacy to help people get out this pandemic. We are not out of it yet. That is the reason there was a critical time that IHLA are having this first Global Health Literacy Summit. I hope in the future, in 2-3 years, when we recall how we have been working on this very much, not only in the very high level, state level, but in the community and also in schools and the family level. It is so important that we have such a summit at this moment. And so I'm very pleased, I personally am very pleased that see many colleagues around the world, but also in Asia. And we are very lucky. We are very pleased to have one of the big country in Asia, the Indonesia, have a very important office, Dr. Annie Rashmani. She has been with us for many years, and now she is leading the Health Science College in East Java, if I'm correct. So I am very pleased that we would raise the attention of this important summit in 2 days. And I also like to bring this camera, microphone to Annie and her colleague Sri Handayana, that you have the microphone and you can adjust how the summit will be very important for your work in Indonesia. Thank you so much. Annie, please.
Thank you, Prof. Peter, for the time that you gave it to me. And actually, I didn't prepare anything. I just want to share why our faculty is joined in this summit or joined in the Health Literacy Association, because actually we acknowledge that Indonesia health literacy is still low, and because of that, many problems come up, like in this pandemic area, many people reject get vaccination, and so many problems arise, like diabetes, also hypertension. So we acknowledge that as faculties in health science, we should more collaborate in health literacy task force. So join in this summit is very, I think it's very important for us to make contribute to public health. I think that's it. Thank you.
Sri, you would like to supplement some of your observation as a teacher in a school, university, how the student can learn from health literacy in the subject. Yes.
Yes, thank you, Prof. Chan. Actually, I'm not preparing anything for the speech too, but I cannot wait for the program, because I know that we are all around the world facing for COVID-19, and this global summit is the right place for us to share our experience in facing the COVID-19, and we can learn each other about the health literacy in our region. And it's also the right place for our students. That, and thank you very much for Dr. Peter Chang that invite our students to join the Global Health Literacy Summit also. Thank you.
If I can raise one simple question, how to become a member of the IHLA? Because this is so important when we have such an important summit. Many people would like to join us. So would Sabrina or Christine, you would like to introduce how people can become a member of the IHLA? Maybe Sabrina, please.
You're on mute. We need to.
Sabrina,
thank you very much. Thank you, Professor Peter Chang. As the Vice President of the International Health Literacy Association, I'd like to invite anyone and everyone. The organization is welcomes people from around the world, from all walks of life and professional backgrounds. Low health literacy has no borders, and neither do we. To become a member of the International Health Literacy Association, it is free of charge. There is no charge. Again, just go to our website and you can register as an individual member or as an organizational member. We have, for example, coming to this conference, as we said, 400 people from around the world. I'm very proud to say we have 62 participants from the United States. Despite the time zone challenges, we have people from all over the world. So I'm very pleased, and I will be there from Boston as in my role as a professor of public health from Tufts University. So I'm very pleased to welcome people not only to the conference, but also to the organization. Together, we can create an international voice for health literacy, and together our passion for health literacy can change the world. Professor Christine Sorenson, the president of the International Health Literacy Association, I'd like to hand it over to you to encourage people to become members.
Yes, thank you very much. And thank you to all my colleagues today who joined this press conference. We are looking forward to see everyone from Sunday to Tuesday next week during the Global Health Literacy Summit. You can follow us on social media. We have seen that health literacy is really a social movement on the rise because it's about empowering people to make their own decisions regarding health and being able to cope with the health challenges that we all face in everyday life, not only during the pandemic, but also in a way to tackle the burden of disease such as cancer, diabetes, and mental health. So let me make a last round of comments before we close this press conference. Diane Levin-Samir.
Yes, thank you. I just want to mention also about the summit. Anybody who will be participating will also have access to all the presentations for the next 30 days as well. So if you're wondering whether or not to participate and you still have today, don't worry if you don't think you can participate in all of the sessions. They will be available to you if you register for the next month. In addition to the presentations that we mentioned, there will also be videos that you can view during the summit and afterwards to see what your colleagues are doing, to learn from some of the experiences that they've been recording. We're going to have a special dance challenge to get everybody moving too. So we're going to hope to have a little bit of fun during the conference as well. So we really encourage you to participate. We really hope you'll have a very meaningful and significant experience, and we look forward to seeing you.
Yeah, thank you very much. And may I invite our colleagues from Indonesia, Eni Rahmani, for last comment.
Thank you, Christine. I can wait to join the IHLA summit. Maybe in the next time I can bring more attendance to this summit. Okay, thank you.
Thank you. And Srihan Dayani.
Okay, so thank you. I also cannot wait to have sharing our experience in the summit for the next 3 days. Thank you.
Yeah. Thank you. And our Secretary General, Sabrina Kurtzrossi from Boston.
I would like to, if I may, I'm not sure if I'm sharing my screen at this moment, but this is the website for the Global Health Literacy Summit. And you can see that at IHLA Summit 2021 with the schedule. So please do go to the schedule and see all the information. The other is that, as Professor Chang had said, if you'd like to become a member of the International Health Literacy Association and learn more about the organization as well as the summit, you can go to i-hla.org and visit our website. So thank you for that opportunity.
Thank you for sharing. And lastly, our Vice President of the International Health Literacy Association, Peter Chang.
Thank you, Christine. If I may recall, many years ago, it's about probably 10 years ago when I was in Taipei Medical University, and we went to do the first health literacy survey on the public health in the general public. And I have Annie Rashmani in my class, but she has her colleague in Samala. And we said we want to follow up the European Health Literacy Survey in a community. And a few weeks later, I didn't hear anything, but then I see the responses from a community level. And I saw Annie's colleague go to the rice field in the potter field, and she interviewed a lady, a farm lady, about what is health literacy, about what is the health situation difficulty for her. And I realized how much we have to learn from health literacy on the individual level, because we are so much different and there's no clear common language. Because Christine mentioned that you did a very important study, how people think about health literacy. How do they call health literacy? Is that in the culture or not? So 10 years later on, we are running the first time Global Health Literacy Summit. I see this is so important that finally we have an opportunity to challenge that. How much do we know about health literacy in different parts of the world, in different corners of the world, for different people? And we have a very, very much work a lot in front of us. And this Global Health Literacy Summit is another chapter of the beginning that we will be able to understand in different parts of the world, in different language, culture, gender, healthcare system, how we can use health literacy in all these small, detailed, sophisticated health service. And I'm looking very much for this first time we will be able to get together and to learn from each other and find a new journey for the world. Thank you so much.
Thank you, Peter Chang. And we see that the Global Health Literacy community is growing. And the idea of the Global Health Literacy Summit is that we come together through the summit and unfortunately not face-to-face as was planned, but in the virtual forum. And may I ask Diane Levin-Samir to just explain in short, how are we actually going together? What are the opportunities for us to meet during the summit?
Yes, thank you. So firstly, we'd like to just mention that the K&A company, the conference company from Taiwan, has been supporting us very, very professionally throughout this whole process and enabling us to get together, not only helping to organize the program and contact and stay in contact with all the participants, but they've also developed a very special platform for us to be together during the conference. And the platform will enable us to go together on live sessions, and also we'll be able to get support in a very efficient help desk. We'll have a video center there at the platform so that people, as I mentioned, can also view videos at their leisure. We'll be able to chat among us, and we will also be able to see the dance challenge and some of the other activities that will be going on during the summit. And all this is a result of a very special platform that has been developed. As you can see here, there's a lobby. We have an auditorium. There'll be posters that already are available to those who have registered. We have over 160 posters, which very high level work is being communicated to all of those who are participating, including not only the abstracts, but also the contact information so people can stay in touch. We also will be on social media, as you can see on the left side here. And we'll also acknowledge our sponsors, our partners, and all those who have supported us along this journey. So the platform, as I mentioned, that has been developed by the K&A company with their web experts. It will be our way of communicating together. This will be our home for the summit for the next few days. So welcome to everybody, and we look forward to seeing you there.
Thank you so much. And this is a great opportunity to see the platform and make appointments with colleagues from around the world. And thanks to all the technology that has proven to be one of the opportunities being developed during the pandemic, when we all had to find new ways of getting in touch. So let me thank my colleagues here joining the press conference today, but also Professor Terence Tsai from the Chang University in Taiwan, who is among our supporters to make this summit a reality, as well as our sponsors and partners. We hope to see you on Sunday, Monday, and Tuesday to exciting discussions on health literacy and how we can bring it forward to the benefit of people and planet. Thank you, everyone.
Thank you so much. And we would ask, Sabrina, that very early, we will release this video recording, and you can share with all media friends and all the colleagues.
Great.
Peter,
thank you so much.
Yeah, thank you for setting it up.
Thank you.
Will you edit so that it becomes the press from opening to closing?
Thank you. Thank you so much. Thank you.
Yes. I hope K&A will do the editing. That would be great.
Okay. Yeah.
So, all right.
Stay well,
so much.
everybody.
Bye. Thank you.
Bye
See
bye.
We
you.
got a rehearsal
See you
now.
in a
So going to rehearsal with Jürgen and
Bye.
video now.
Right.
Bye
Have
bye.
fun.
Bye bye. Bye bye.
Go back to sleep, Sabrina. Thanks, Peter, for the work for organizing this.